Dr. Kyle, thanks for your time today. We're going to talk about radiographs in dentistry today, and we're looking at a common set of radiographs. Talk to me about what what type of conversation a doctor would currently have with the patient around these types of radiographs, and then how can we use the Pearl AI software to, elevate the trust level that a doctor can have with a patient.
Yeah, I would say most of the time, doctors are going to be talking to patients, and they're going to be pointing at them at things like this. They're going to say, "You see, Mrs. Jones, you see how right here there's this gray area, and there's this other gray area right here, and then there's this third gray area right over here. You see, that's a cavity." And they're going like, "What? Wait, are those my toes? Like, what are we talking about here?" Right? I mean, there's research to show that 71% of patients said they have no idea what they're looking at in an X-ray. And so when we're trying to show them something, they have no idea. Now it changes to be something like this. You see, Mrs. Jones, this pink area? That is the cavity that we see in your mouth. And you see how it's almost touching this purple area? This purple area is actually your nerve. This is something that we may want to take care of quickly, because you see, we're only going from that pink through that tiny area of green and could potentially touch that purple.
And if it touches the purple, is that then where we need endo? And
that means we're talking about a root canal. Yeah. Now, this, of course, is a two-dimensional image of a three-dimensional object, so there can be some overlap, but this is actually a pretty big cavity.
Wow. So go back to the before Pearl. Yeah, I will say I'm not an expert at looking at radiographs. It would be hard for me to discern the significance of that gray area, right?
Yeah.
I can see there's a slight shade gradation, dark gray to light gray.
Yeah.
But there's no dramatic effect as to what I'm perceiving as a patient.
And what's funny is when we created Pearl, we started this back in 2015, this specific product called Second Opinion came to the market in about 2021. We really made it for doctors to assist doctors in diagnosis, make sure we're not missing anything. I mean, we doctors have so many decisions to make. We wanted like the easy button on reading radiographs. But what it turned into so much and all the feedback we were getting was, oh, it's so nice now because I can show it to my patients and my patients can actually see this. So it's funny, like what we call this tooth parts, this little colored area, that was just the thing that we had on the back end. We didn't even show it at first. And then I was talking with all of my colleagues that were using it, and they were like, or I think I showed some of them like something on the back end that I was looking at, and they were like, wait, can we have that? Can we have all those colors? And it turned into like so much of a patient engagement tool, trust building.
This episode is brought to you by the Badger Screw Breakthrough, the ultimate prosthetic screw designed by engineers, breaking through all the screw noise. Optimized for direct to multi-unit abutment cases with a sleek 2mm diameter. Mill faster, build stronger, hide those screw channels. American made with best-in-class performance across multiple metrics. The Badger Screw prevents screw loosening and reduces fractures. Great prosthetic outcomes start with great engineering. Visit smartmouthtechnologies.com today. That's smartmouthtechnologies.com.
Because, I mean, even like me, I love cars. I'm a car nut. But when I'm not a guy that can like rebuild my own motor or something. So when I go to my mechanic, I drive 45 minutes to go to a mechanic. I probably pass 100 mechanics, maybe more. And my wife is like, "You're insane. Why are you going there?" And I'm like, "I go there because I trust Doug. That's why." And he could even show me the belt. He's like, "Oh, we need a new timing belt." He could show it to me. I'd be like, "What am I looking at here? I have no idea what I'm looking at." And so this has this built-in trust because the AI has no reason to find more. It doesn't get any more pleasure. It doesn't make any more money, right? And so having something that not only we can show them that is third party, non-biased, but also we can quantify. So even if I take off this tooth parts here and I go here, we say that this is mostly in dentin. Now, that's an easy one for for doctors to see. And there's this small percentage that is in enamel as well. It's gone through the enamel. Another thing you'll see here, and this isn't really the best image to show for this. Let me see if I can find another one for you. Maybe something like this. Is you see how there's different color lines? You've got green lines, you've got yellow lines. Okay, so this is the measurement from what's called the CEJ of the tooth, where the cemento enamel junction is, to the bone. This is what's used to measure periodontal disease, gum disease.
Okay. Yeah. Those are
So
what you measure with the Perio probes.
Perio probe. Yeah, similar, but this is a radiographic way. So Perio probe is what's happening above it, like on the actual tissue. This is looking at radiographic bone loss. Okay.
Got it.
Traditionally, you come in and you say, Rob, you come in and you say, hey, Dr. Stanley, I'm here. I need to get a cleaning. That's what I really want to do. And I say, well, we can't do a cleaning because you've got gum disease. It's going to be 4 sessions. It's going to be $1,200. You're like going, whoa, whoa, whoa. This guy is like just trying to buy another Porsche. What is going on here?
Yeah.
But then if I come and say, Rob, you see these measurements, you see how some of them are yellow and some of them are green? The yellow ones are the ones where you've actually lost bone. You see how they're a little bit longer? Now, when you lose bone like that, this means you actually have gum disease. So the AI and I agree in this case that, this is something where you actually we need to do a periodontal therapy for you. You really can't just have a normal cleaning. And now this case, there's not a lot of yellow ones, but just in general, just being able to quantify and colorize them is a huge advantage. Because let's say you come in and I say, yeah, we've got a few yellow ones. Let's watch these. We can do a normal cleaning right now. When you come back in 6 months or in a year, we take new radiographs, we'll check it. Then we can actually go side by side and see, have they progressed? Have they stayed the same?
Better or worse? Yeah.
And so it's like just getting data makes it so much easier to have these conversations.
This episode is brought to you by Rebel Crown. Are your dental crowns seated in minutes with flush margins and personal one-on-one service? If not, it's your time to rebel. The Rebel Crown is designed by your personal technician who you can call or text anytime. Milled with premium Harvest nanozirconia, manufactured here in the USA with a 1-week turnaround time. Learn more at rebel3d.com. That's REBEL 3D.com. Yeah, that two-dimensional photo that you showed with all the colors, I mean, that is very patient-friendly. And this objective conversation around here's the root, here's the dentin, here's the enamel. Like this now becomes a much more meaningful, trusted conversation that it's like now putting it in a language that the patient can comprehend. And now you're having a conversation on the same plane versus
it's just human to human talking.
Exactly. It's not the conversation of I'm your dentist. I know how to read the radiographs that you don't. You should trust me.
Yeah, what I say about these sometimes is it's kind of like, have you seen those videos of when people that are colorblind get those special glasses and then all of a sudden they can see the world and they start crying and stuff? It's kind of like this with our patients. It's like, this is what we doctors see, but the patient sees this.
100%.
We see this, they see this. So it's like giving them these goggles that they can put on and go, oh my gosh, that's what you see? Like this image is actually a good example. It's a good example for many reasons. One is because AI makes mistakes just like humans do. Okay, I think this is a big misconception. People are like, oh, AI is perfect. And AI is not perfect.
It's a good guide.
It makes mistakes just like we do. Okay, so it has false positives, means that it finds things that aren't there. It has false negatives, which means that it doesn't find things that are there. But what we were able to show with 9 different FDA approvals was that every time you take a human and you add AI to them, they always get better, 100% of the time, even with false positives on both sides. It's kind of like what happened with Tesla. I think Tesla came out with some research showing people that use they call it self-driving, which I hate that name. It's really assisted driving, actually getting less car accidents. And that's how it should be, because yes, the AI is not perfect. You can't go to sleep in the back of it and, drive to Vegas. But same thing, humans, we're not perfect either. Like I've been driving for I don't know, what, 30 plus years or something. And I don't get in car accidents all the time, but I probably have one a decade. It'd be nice if I had
Sure.
0. So this is a good example because this actually has a false positive in it. So this is actually, in my opinion, a false positive. So it's saying there's caries, but there's not. All right. But this, I think, is a true positive. But why I think this is a good example is because let's say this pink one is a true positive. Okay, let's say it's right. You could have this conversation. Mrs. Jones, do you see this little yellow area right up here? And they, oh yeah. You see how it's still in the white region? It hasn't crossed over into the green. In our practice, we either watch those or we try to remineralize them with some starch particles. There's a company called Greenmark that I'm an advisor for, actually, that can remineralize these small little enamel lesions. But you see down here, there's a cavity that's gone through the white and into the green. When it passes that green threshold, that's something we need to take care of.
Yeah, that's a much more objective conversation, and you're differentiating, like, yes, there's, cavities in both areas, but one has a different level of severity than the other, and we can clearly talk about it, show it in a way that I can see and digest and agree with you.
Yeah, because look, if I showed you this, do you see that little area?
That's really hard to see with the naked eye.
Really hard to see. And one of the things is that our small little human eyes, we see about 50 shades of gray. Okay, like the name of the book and the movie. All right, so those of you that are into that stuff, but an AI can see like 700 to 800 shades of gray. So we can actually find things much sooner than the human eye because it's reading every little pixel change. And what that means is that we can treat it sooner. That can be a preventative, that can be a watch. There's some people that would go in and do a filling there. And I think the more we can prevent things, the more trust we build, and the more we're going to be perceived as being part of the medical community. Because so much of what we do right now is reactive. Like, we're very preventative in hygiene, periodontal disease, that kind of stuff. But in restorative treatment, we're very reactive. We wait for the tooth to break, then we fix it. We wait for the caries to happen, then we fix it, right? And so if we can be so much more preventative, I think that gives us a lot more respect with our patients.
100%. Like, if you're advising a patient, like, hey, there's this small yellow lesion, let's take care of that so you don't need a filling or you don't need a crown. Like, I have a plan to take care of this before it becomes bigger. And my guess is the cost and the treatment for that is significantly less than the cost of a crown, right? And so there is a cost to it, but let's be proactive and take care of that now before it becomes something bigger. And yes, that's preventative medicine, and it's lower cost, and it's going to save my natural tooth for longer.
Yeah. This is kind of an interesting thing. You see this kind of yellowy orange thing up here?
Mm-hmm.
So it says, no root tips visible. Okay. So that means somewhere in here, we're missing a root tip. Now, why is that important? You see how down here, I'll pull this up. You see how down here, you can see the tip of the roots.
Yeah.
That's really the point of, this is called a periapical image, is to see the tip of the roots so that we can make sure that there's no periapical lesion, it doesn't need a root canal, that kind of thing. But sometimes it's hard to catch the tips of the roots, and our dental assistants, our dental hygienists, or even doctors that are taking x-ray images, we take them and we just say, okay, I did all the images, now everything's good. What this is doing is actually giving your assistant feedback on maybe they need to take another radiograph to capture that root tip. Because look at this, we captured this one, but we don't have this one, and we don't have this one. So really, from like a liability standpoint, this can reduce your liability by informing you and the assistant that, hey, maybe we need to take another radiograph. Because, Rob, this is what usually happens. They take all the images, they take everything off. If they're still using lead vests, which the ADA came out and said don't use those anymore, but sometimes they are. Taking them off, putting them down. They come grab you in your private office. Doctor, we're ready for you to read the radiographs. And you come up and you check everything and you go, oh, we got to retake this one. I can't see the apex on these. Yeah, oh, okay. And they get everything out. They re-put the thing on. They put, and this is just simple feedback.
Yeah, it's like a training tool for your assistants and an instant feedback tool. And my guess is the feedback here is like virtually instant. Like, what's the process time when you upload radiographs into Pearl? How
it
quick
depends
are we
on your
that?
internet, but usually it's around 8 to 30 seconds. So it's instant enough, right? So
Fast
it's kind of
enough,
like,
yeah.
by the time you take the second image, the first image will be up.
Yeah. And so my guess is in your practice, if you probably coached your staff that if you see, this yellow image, then retake it before you call me.
Yeah. Mm-hmm.
Yeah.
Yeah. Yeah.
And which is going to make your time that much more efficient.
If they really looked at it, they could tell that they missed it, but they're going so fast or they're, distracted by something. Because this is one where it's barely missing it, but it did.
I
know.
Yeah.
Because we do have this one. We even have the mesial root of this one, but we don't have the distal root here. We don't have this one here. And this is a long root, so I get why they missed it. But we just need to reconfigure the angle, and they should be able to get that. When you see this global view, so this is just how we normally look at an X-ray. You see these little dots?
Mm-hmm.
So these little dots are just giving you insights on what may be happening in this radiograph.
Oh, so little breadcrumbs little breadcrumbs of what's going on there. So I should go double click on that.
Yeah. So this one, we've got 4 different colors. So in this one, we've got some carries. We've got some margin discrepancy. So let me turn this off so you can see this. See these here? So this is just saying, hey, there's a notable margin here.
Open margin.
Check it out. And the doctor may look at that and say, oh, I know this patient. They've been here for 10 years. They're great at flossing. That's stayed the same. I would never do anything on this patient. Or they say, oh, gosh, he or she always gets recurrent decay. I think that's one we should change. The goal isn't to tell the doctor what to do. The goal is to point out areas of interest, and the doctor can decide what they would normally do. They can take their normal due diligence and decide what they would do.
So after a doctor's been using Pearl for, let's say, a year, and you have a follow-up call to say, how's it going? What is the common feedback that say, Dr. Kyle, I've been using Pearl now for a while. Man, here's what I love. Here's where it's really helping me. Like, what are the things that they're saying to you as to why I love Pearl after integrating it into my workflow?
There's usually 2 things. One thing is my patients love it. My case acceptance has gone through the roof. We've had a lot of practices that have increased their case acceptance by 30%.
Whoa.
Which is massive. That's doing no more dentistry, or like not seeing more new patients, let's say. Just increasing your case acceptance can go up like crazy. And the second thing they usually say is they always have a story. They always have something like, there was this one thing and I had missed it the previous year. Pearl showed it. I checked it out. I did transillumination and found it was actually something there. I drilled into the tooth and oh my gosh, there was caries there. I didn't even see it.
So it's covering for that false negative.
Yeah. Mm-hmm. You do have doctors that use really any type of AI. I mean, this is not even just dentists, but humans that get so angry if there's a false positive or false negative that they just don't have the right mindset. And so it really takes the right mindset. I mean, I'm sure you use a lot of AI, just like large language models.
Yeah. Oh, yeah.
What's your favorite
have to hold them accountable.
choice?
I use Grok. I did a Black Friday special and signed up for an annual thing because it was like half price for the year. But I know ChatGPT is great. But yeah, like, I use it for research. I ask it to cite sources. Yep. I'll ask it to give me some inspiration around different business strategy stuff. But I do feel a strong sense of ownership that whatever work product I'm going to put out as a result of some AI research, I'm still 100% accountable. Like my name
Totally.
is on the output
And
and
that,
I have to be
see,
responsible.
your mindset around AI is exactly how it should be. Is that this is a tool to assist you in your task. And it's the same thing with anything happening in dentistry or medicine or anywhere. It's like these are tools. You, yes, it can be used poorly. Yes, it can be used really well. It can make you more
Mm,
efficient. I mean, you think about something like ChatGPT. I know I start seeing so many posts on Instagram that have M dashes in them that say like the word delve into them, which are such ChatGPT things that you just know someone put it on, they copied it and they put it on. And now I see it as like, ooh, this person didn't even spend the time. It doesn't even seem real to me anymore.
mm,
But I think the people that are using it, it's like the 80-20 rule. You know, the people that are using it to get 80% there and they're doing the last 20% of the work,
yeah.
those are the smart people. And that's really what's happening in radiographs. The AI is doing 80% of the work, but you still have to check it because it makes mistakes, just like we do. So this one, let's see. Let me
I want to talk about that. If you see false positives, can you mark them or report them in a way
You can.
that then
Yeah,
maybe trains the model better
that's
or
right.
kind of keeps
hmm
track of things?
Yeah, so there's this little thing on the bottom right says help us refine our AI. You can tell if there's something that's wrong, which is a false positive, or if there's something that's missing.
Mm.
And then you can also go in and adjust things that are already in here too. So this is actually a good
So
one.
if it's
Like
more
this has a false
severe,
positive because it's
okay,
measuring bone measurements on an implant when
right.
there's really no CEJ on an implant, right? But look at all the other ones. You've got some green, but then you've got some yellows here. So this may be a borderline perio patient. Talk to them and see. You've got this margin happening here. There's different measurements. And then the thing that I didn't show you is this is just living in your um, your imaging sensor software or in the Pearl software, but you can actually cross-reference it into your practice management system too. So that's something called practice intelligence. So second opinion takes everything and puts the overlays on, assists you in diagnosis, shows you the different colors, the measurements, the data. But then what practice intelligence does is it takes all that information from your radiographs and cross-references it with your practice management system. So let's say it finds this little potential caries here, right? It's going to
Okay.
look and say, is there anything treatment planned on this tooth? And if there
Ah,
isn't, it's going to say, hey, doc, take a look. We didn't see a filling, inlay, onlay, crown, or extraction on this tooth. Take a look. And then you can go decide if you want to treatment plan something or not. Like in that specific case, you may say, oh, no, I'm just going to watch this. Like this is still an enamel. I know this patient, they're fine. I'm just going to watch that. Or you look at all these other fillings they've had and go, ooh, gosh, they're caries prone. They got two crowns, they got a big amalgam, they got fillings here. Maybe we should do preventative and remove this now. So it's
mm,
totally up to the doctor or whatever he or she thinks and whatever their philosophy is. But then it's going to come up in the schedule too. So next time the patient is in, these are actually real patients from today. Our hygienist broke her arm, so we have no hygiene. But when I roll over this patient, it's going to show me that she has no prior perio chart. Their cleaning is overdue. They have no existing perio chart. And like here, it's real easy to see. When was their last FMX? Their perio chart is overdue. They have no previous cleaning. I don't know what the situation is with this patient. So it's giving you an idea of what's happening. And then on the top, it summarizes what's happening in your schedule today. We have 3 patients that need to get perio-charted, 2 patients that are overdue for a cleaning, 2 patients that need radiographs, and there's 3 patients that have treatment opportunities. So treatment opportunities are things that the AI found
Hmm.
that could be false positive, could be false negative, but we'd like for the doctor to take a look at and see if it's something that they want a treatment plan.
Yeah, it's like a an accountability partner for making sure you're at least addressing all of these potential concerns. You may have, without Pearl, you may have looked at the radiographs and only seen one, or maybe you saw two, but now you have to manually make a note somewhere, go put it in your schedule. But this is just feeding that data saying, hey, there's 3 opportunities here. How are you going to handle them?
Yeah, exactly. It's totally up to the doctor. This is something that we could never do before AI is look at opportunity funnels. So if I came to someone and said, you know, have you ever thought about bringing a specialist into your practice? And they're like, oh, yeah, I have thought about that, but I just don't know if I have enough patients that would really fill their schedule.
Oh,
And you could look at that. Say, like here in my practice, there's 16 patients that have potential endodontic therapy. So, oh, okay, well, if I had a specialist, that's like 2 days worth of endo right there, right? Or like this is a good one. Look, impaction opportunities. We only have one patient that has impaction opportunities. So probably not great for surgery in my practice. Okay. But restorative, there's a ton. Oh, sorry, this is restoration replacement. So this is when patients have previously open margins, and this
hmm.
is more around caries. So it's taking the entire data set because the radiographs, we get all the data from it. It's like what Google does with the internet, how it makes it queryable.
Hmm.
So you can go look for a specific type of patient. Let me look for a patient that has bone loss and that has caries and this or that. Another thing is that it helps you schedule your patients, keep the chairs filled with high quality patients. So traditionally in a dental practice, they look at people that are overdue for hygiene if they're starting to try to fill a hygiene chair.
Yeah, for patient recall. Yeah.
Yeah, exactly. And they say, "Oh, who's due for hygiene?" And they
Yep.
just would print a list and then they would call, text, email and try to get these people in. But what this does is takes that list and reprioritizes them on who needs the care the most. So yes, we're still going to call the patient that just needs exam and x-rays for sure. But I think we should call this person first because they have a potential crown, potential little caries there, and they have an incipient caries as well. Like, let's call them first. Let's fill our chair with high quality patients that
Now,
actually need the care more.
can you email the patient and say, hey, your radiographs are showing this. We'd love to talk about this treatment?
You can, yeah. So you can do a printout. Let me see if I can show you that. You can do a printout here. I hope that it's not going to show the patient name. Let me see. Okay, no. But yeah, you can do a printout and you can pick like a specific image, all the images. You can click on or off or whatever you want. And then it'll do a printout that'll show them exactly what's happening.
Generate like a PDF file that you could
That's right.
email?
Yeah. So
That's
people are
amazing.
actually doing this and sending it to insurance too. So they're getting better insurance
Reimbursement.
reimbursement too.
Yeah, you talk about that for a second. The um, items being rejected from insurance. Do you get doctors saying, hey, I have better reimbursement rates now that I've got this
We
AI
do, yeah.
tool sort
And
of
this was something
backing
that,
me up?
again, we didn't think of using this tool for, but what people were doing, why we created that printout feature was because people were saying, yeah, we're just screenshotting it and sending it to the insurance company. And we were like, oh, well, let us do that for you so that it's a little bit easier. Because I remember when I first got out of dental school and out of residency, and I was working um, at my buddy Matt Najad's, who's now my partner at my practice. He had a previous practice that we were working in together, and we would print out a piece of paper, take a red marker, circle something, put an arrow, right, carries or something like that. And that would actually help us get insurance reimbursement at the time. And it's kind of just doing that automatically now.
Wow, that's awesome. So good. And we could go down the rabbit hole of the insurance game that gets played. We don't
Yeah.
want to throw anyone under the bus, but I'm betting having Pearl AI at your back makes it harder for the insurance companies to justify claim rejection.
Yeah, again, it's not a guarantee, but it's a tool, just like anything.
Mm.
One more tool in your quiver. One more arrow
So
in your quiver.
you're a co-founder of Pearl, which is amazing. So I'm assuming you have a heavy hand in the development roadmap and all that kind of stuff. And you're also a user of Pearl. You know, being a user now for 4 or 5 years of the radiograph software, what would you say like you're most proud of? Like, hey, this is what just really makes me excited to talk about Pearl with doctors.
I love the idea of reducing stress for doctors. That's something that I'm super passionate about. If anybody follows me on Instagram, that's a lot of what I talk about. And this is one way to reduce stress for doctors because we don't love to sell. Most are pretty bad at it. And that's even like a slimy, ugly word in dentistry. So
Yeah.
when you can educate and show a patient and they see it, I think it reduces a lot of stress for my colleagues. And building trust with patients, I love dentistry so much. I'm so passionate about it. I love this industry. So I hate when I hear people talking shit on dentists and saying, "Oh, they're all scam artists and, you can't trust them." And so anything I can do to build trust with the, normal consumer is something that I'm really proud of. And so we have people now that will message me, like some of my friends from high school or something that aren't dentists, and they'll say, "Hey, is there a doctor near me that's using your software that I can go to because I want someone
Mm,
where I can go that I can trust?" And I
yeah.
also get people saying like, because they see my stuff on Instagram, they'll say, "I'm so much nicer to my dentist because now I know what they're going through." And they follow me just because we've been friends for years or something. And they're like, "I'm so much nicer to my dentist." I mean, that is something that I'm really proud of.
That's amazing. I'm not surprised at that answer. I'm just assuming that your desire to reduce stress through this technology was, probably long lived. Would it be a correct guess that as you're showing treatment and showing it through the lens of Pearl, your stress is reduced because you have this confidence that I'm not trying to sell, I'm just trying to explain, here's what's going on. And then if they reject treatment, there's no stress of, well, did I do a good enough job explaining this to them? Like, is that my fault that they're rejecting treatment? Because if you really care about someone and you truly want their teeth to be healthy, it would be stressful if patients are rejecting treatment and that's not good for them, you know?
Right. It's even harder when they assume you're just doing it for money.
Mm,
Because you know a lot of dentists, just like I know thousands of dentists. I mean, almost every dentist I know is a good, able person that's not trying to sell patients. They're just trying to
yeah.
do their job. They're trying to make their patients healthier. And in the process, yes, we get paid for it, just like any other job gets paid. We don't run charities. And so it's even more hurtful when you're really trying to help somebody and they're like, "Oh, you're just trying to scam me." So the answer to your question is for sure. I think it makes it much easier to have, I mean, the one of the products called Second Opinion, to have a built-in second opinion when it's right there for them. Like before Pearl, we used to say, feel free to go to another doctor and have them take a look. They may have a different opinion or they may have the same opinion because we're all trained differently. We all have different philosophies, but I'd encourage you to go there. And usually just saying that, someone would be like, "Oh, no, no, it's fine. Like, I trust you." Right. But this is built in. It's like there's no reason for it to find more. I mean, if we created this product and it just found everything everywhere, no one would use it.
That was actually leads into a next question of in the average patient, I'm sure age and personal hygiene matters, but in the average patient, how many opportunities for treatment is Pearl discovering? Like, how often do you get someone that's got, like, 5 gold stars, no problems, you're good?
I don't know if I have that answer for you. What I do know is every practice that we have integrated with, unless they're a new practice or something, we usually find at least $1 million of treatment sitting on people's practice management system.
Wow. And
And
so
this
there's a
happened in my own practice too. It's not like, my practice is amazing but there was stuff that was sitting there. I mean, we found patients that were getting prophies done, like regular cleanings for years, and they had bone loss. They should have been on perio maintenance. And somehow they got into the hygiene role and they just kept getting prophies. I mean, it was just like an oversight. There's things that we miss. There's things that we find that weren't actually something. So there's big opportunities sitting on people's practice management system, sitting in their digital charts.
Mm.
And so many people focus on this idea of like, I need to grow my practice, so I need to get more patients, more patients, more patients, more patients. And in most cases, like I said, I don't think we've integrated with a practice that isn't like a startup practice that didn't have $1 million worth of work sitting in their charts already. So it's not getting new patients in, it's maybe getting old patients back in, getting them back on recall, diagnosing better, finding something, getting a new technique that allows you to treat something that's already there. Or maybe you're referring stuff too, it doesn't matter.
This episode is brought to you by the Badger Screw Breakthrough, the ultimate prosthetic screw designed by engineers, breaking through all the screw noise. Optimized for direct to multi-unit abutment cases with a sleek 2mm diameter. Mill faster, build stronger, hide those screw channels. American made with best-in-class performance across multiple metrics. The Badger Screw prevents screw loosening and reduces fractures. Great prosthetic outcomes start with great engineering. Visit smartmouthtechnologies.com today. That's smartmouthtechnologies.com. So, Dr. Kyle, when a doctor gets started and bringing Pearl in for the first time, does it retroactively look at their historical X-rays and then analyze opportunity from everything that occurred prior to the day I install Pearl?
So we go back a certain amount of time. Usually it's like 18 months because generally radiographs older than that don't really make sense. You can go back as far as you want. I mean, we have some people that are like, let's go back 10 years, and there's a price for that, but it usually doesn't help that much. But for sure, and you learn so much from that. We've integrated in thousands of practices in like 120 different countries, and almost every practice that we integrate with, we find at least $1 million worth of treatment just sitting on the charts.
Wow.
And
That's incredible.
so many people think I need to grow my practice. I need more patients, more patients, more patients. More patients is the answer. And so many times it's just treating the patients that are already there or getting people back in from your recall list, which is way easier than getting a new patient in.
You're absolutely right. They already know you. They've already been to you. You're already familiar. They're not coming for the first time. And there is this commercial opportunity, which that's a part of the business. However, it's also patient care, right? It's the opportunity represents, yes, there's commerce, but there's also undiagnosed or untreated problems that if your heart is to serve the health of your patients, they're not being served, right? You have underserved patients in your practice that are just not well informed as to the status that they're in and what they need treatment
I mean,
on.
there's even things that we make mistakes on too. Like I said before, is we had patients in our practice that were getting regular cleanings when they should have been having perio maintenance, or some that should have been having scaling and root planing. And it somehow fell through the cracks, like, again, we make mistakes, our hygienists make mistakes. And this is just one extra layer of someone like looking over your shoulder, being like, hey, did you see that thing on the lower left? And you can use it you can be offended by that, which some doctors are, or you can say, oh crap, yeah, I didn't see that. Or I looked at that. Oh yeah, that's nothing. I'll check that in 6 months.
That's incredible. Well, I know we're kind of wrapping up. Last question. Any exciting new features coming that you're free to talk about? Like anything, I'm assuming you're constantly developing and evolving the product. Like what's around the corner for Pearl users?
Yeah, so we just got FDA approval for CBCT. So
Oh,
we're the only
amazing.
company in the US to have that. And we haven't released it yet because the FDA approval just came out a few months. It's been something we've been working on for 4 years, I think,
Mm,
and maybe longer, maybe 5 years. And so getting that FDA approval is a big step forward for the company and also for doctors. I mean, that's one of the first questions people ask is, when is this coming on CBCT?
I
So
bet.
yeah, coming
And
soon.
will there be, if you're free to share, like proposed implant sites and like based on bone density and that kind of thing? Like
That's
just
where it's headed. It's headed to where we get to this point where it's kind of like the easy button, where even if there's implants that are there or teeth that are there, it may find these hopeless teeth. Let's say we're planning like an all-on-X procedure. It can
right.
find the hopeless teeth, digitally remove them, place the implants in the ideal depth, ideal position based on zero bone loss concepts and all the research, pre-mark where the abutment should be, what size, what angle, what thickness the
Wow.
connections should be. So that's further down the road, but that is where we're going to get to is really the easy button. And, the doctors and the technicians and, the designers can always adjust things. But even if it does 80% of that work, I mean, that is a huge saving. Another thing that's happening that we're coming out with soon is calling it Scribe, and it's listening to your conversations and pre-writing your treatment notes.
Listen to the conversation with the patient.
Yeah,
Wow. So it knows your voice, knows the patient voice.
yeah,
And then is it taking notes on what they're like agreeable to or scared about that they want to fix and that kind of
yeah, really
stuff?
everything. You know how like when you do a Zoom now, you can get that AI summary.
Mm.
It'll be something like that, but really more from a treatment note, liability, um, standpoint.
Yeah. So all the informed consent, very
Yep,
detailed. Like we talked about these things and you rejected
exactly.
treatment. So,
Yeah.
that was your
Because that's one of
decision.
the biggest pain points doctors have is they're like, I work on 8 patients a day, and then I've got 90 minutes of writing notes every day if I didn't write them in between my patients. And, I didn't
Yeah.
remember exactly what they said. And that's just such an easy problem for AI to solve. So more LLM, large language model stuff coming as well.
Amazing. Well, Dr. Kyle, thank you so much for spending time with us. I can't wait. We should do another recording when the CBCT stuff is released, and
Yeah.
and
And
uh,
there's,
we'll do a deep
we'll
dive.
put in the show notes, I've got a special I call it my founder's discount, that people that are listening to this can look in the show notes. And if you make a demo through that link, you will get my founder's discount.
Amazing. All right, we'll put that in the show notes. So
Awesome.
thank you so much. It was a pleasure
All right.
talking to
Thanks
you
for having
again.
me.
We'll be in touch.